Soccer players, basketball players, football players will rupture in their knee. It's usually a rotational load. Probably half the time there's contact, but a large percentage of the time there's a non-contact injury when the ACL pops and tears. When the ligament tears, the knee becomes unstable, and it's the instability really that bothers the athlete down the road. We take a tendon from the athlete elsewhere, whether it be the patella tendon, the hamstring, or there's a new technique that's being developed where people use the central portion of the quadricep tendon. Typically, you drill bone tunnels into the end of the thigh bone and the proximal end of the shin bone, and then you pass the graft through the bone tunnels and then secure them on the respective sides. I would say it's much harder to rehab the anterior cruciate ligament than it is to reconstruct it. I devote way more time and energy to making sure my patients meet their landmarks with their rehabilitation than I do actually needing to reconstruct it. We've come a long way from the original ACL reconstructions of the 70s and 80s. And at this point, I would say we've refined it quite a bit.